Thank you for the invitation. My name is Francesco Di Mario. I'm Professor of Gastroenterology at Padova and Parma University. I'm 75 and I'm retired now. Well, my interest for the components of GastroPanel are from 70s, the last millennium. But the first time I became familiar with GastroPanel was in 2000 when in Helsinki, in Finland, in Biohitin was formalized the name of GastroPanel. My current interests are the diseases of upper digestive tract and in particular gastritis, atrophic gastritis, gastric cancer, reflux disease and in general at-risk situation for neoplasias. Okay, Parma is one of my university, and I try to introduce in Parma area the concern to have GastroPanel as a useful instrument not only inside the hospital university, but spread for the population of the Parma area. So the model is to spread the ideas, the scientific ideas outside of the hospital. Yeah, GastroPanel is related with the Parma model because I try to interest general practitioner in the field of upper GI diseases to introduce as the first tool for diagnosis a non-invasive tool like a blood sample, I mean GastroPanel, because before to introduce other invasive tool like gastroscopy, for instance. This is a very important point because in my opinion, not only patients suffering by upper GI disorders could be endoscopized. First of all, to me, it's important to establish by means of a blood sample, I mean GastroPanel, the effectiveness to perform endoscopy. And the test is able to single out patients for this. Well, dyspepsia is an enormous problem in clinical practice. I mean that patients suffering with dyspepsia could have H. Helicobacter pylori infection or gastritis or reflux disease or an important disease like cancer. So our task as a physician is exactly to try to explore the exact nature of the disturbance in the single patients. And GastroPanel is able absolutely to decide it. To me, no, because you know, half of world population is infected. I mean, more than 4 billion of people, but we are not interested to all these people, but only people with damage in the stomach caused by the bug. And GastroPanel is able to clarify not only the presence of the bug in the stomach, but also the damage. Yes, because GastroPanel is based on 4 parameters, and 2 of these parameters, I mean PG1 and PG2, are important to determine the progression of the infection. I mean that If it's present atrophic gastritis, PG1 levels will be very low. This is a dangerous situation. Otherwise, PG2 levels could be elevated. It means no dangerous situation, named non-atrophic gastritis. Okay, PPIs are very, very important drugs. They are introduced in 1989 in Europe, and lot of people assume PPIs. They are essential to cure acid-related disorders like peptic ulcer or reflux disease, but unfortunately, a lot of people with simple dyspepsia were treated with PPIs. This is potentially dangerous because of the inhibition of chlorhydric acid. And for a long time, this could be dangerous. Another very important point, we performed 2 studies on this subject, and we demonstrated that by using GastroPanel, it's possible to single out patients prone to assume PPIs and patients without acid in the stomach, almost in age, and then in which the use of PPI is absolutely inappropriate. Well, atrophic gastritis is definitively at-risk situation for gastric neoplasia, and is the goal of our strategy in prevention of gastric cancer, because the correct diagnosis of atrophic gastritis could generate a correct follow-up for such patients in view to interview before the development of gastric cancer. GastroPanel is absolutely of importance in this field, in this goal, because the negative value for this diagnosis is 98%. It means that if PG1 values are normal, atrophic gastritis is absent. This is a matter of debate. In my opinion, yes, because unfortunately on 100 people with gastric cancer, 91 are diagnosed in advanced phase. It means that after 5 years, they are dead. This is unacceptable to me. So GastroPanel could be very useful for this purpose. But we could calculate the cost benefits of this strategy, and to me is applicable in almost in countries with high risk for gastric cancer. This point is absolutely important because all patients at the end ask to the doctor about the magic pill to feel better. And until some years ago, for atrophic gastritis, we haven't nothing for our patient. But just from Helsinki University, now we could offer to our patients a product named Acetium, which is able to bind a very dangerous substance in the stomach, in atrophic stomach, I mean acetaldehyde, and more important, patients feel better. And last point, we observe a recovery in gastric function. It's a true pleasure to me to join Finland, Helsinki, and I bring with me data because I'm a physician, I'm a gastroenterologist, I'm a scientist. I try to collect data in the field of precancerous condition of the stomach. So I bring definitively with me new data to discuss with colleagues and possibly to explore new possibilities to interview in the favor of patients by GastroPanel or other tools.